Welcome to the Generous Benefits Podcast, where we help employers build benefits that are meaningful, affordable, and focused on real people. I'm your host, Amanda Brummitt. Today, we're shining a light on something that could be a game changer for many patients, and yet very few people even know it exists: hospital financial assistance programs under IRS 501R. Under this federal rule, nonprofits are required to offer financial assistance programs to eligible patients. In many cases, people with high deductible health plans or no insurance at all could qualify for significantly reduced or even eliminated hospital bills. But there's a catch. Most patients don't know to ask, and many hospitals don't exactly roll out the red carpet to inform them. So I've brought in someone who knows this topic inside and out, Justin Leader. Justin is a healthcare advocate and industry expert who spent his career helping employers and patients find fairer, smarter ways to navigate the healthcare system. As a managing partner at Benefits DNA and a fierce advocate for transparency and affordability, he's here to explain what 501R really means and how patients can tap into resources that may already be available to them. Let's dig in. Well, Justin, thank you so much for being here. I know how busy you are, so I really appreciate you carving time out to share information with us. If we could just start with you by telling everybody who you are, personally and professionally.
Thank you, Amanda. I appreciate the opportunity to be here. I think the world of you and Brett. And my name is Justin Leader. I'm President and CEO of Benefits DNA. We're a health and welfare consulting firm that does a lot of traditional brokerage things, but then a lot of unique things, at least for our industry. We do fiduciary training services, audits, and help plan sponsors understand what it means to be compliant by today's standards. More importantly, I'm a husband and the father of two young boys, ages 3 and 6, living here just outside of Hershey, Pennsylvania.
Okay, so Justin, let's with the basics. And I asked this coming from a total place of vulnerability and ignorance, in that I've run a hospital. It was a for-profit hospital, but also run a hospital-based medical group that worked in nonprofit and for-profit hospitals for years. I'm almost at 20 years now, and I had never heard about IRS Rule 501R. So let's just assume everybody's as dumb as I am and start with, what is IRS Rule 501R and why should patients and employers care about it?
Yeah. So I didn't learn about it either until I had a family member who became very ill
Hmm.
with stage 4 cervical cancer and ultimately did not have a lot of money and was really weighing, as many folks in this country do, not necessarily how can I beat this illness, but how can I afford it?
Hmm.
And yeah, it started to get a crash course. And then I met some others in the industry that were focused on really benefit solutions for the ALICE demographic, asset limited, income constrained, yet employed.
Okay, thank you for that.
It's a large portion of the population that people just assume have jobs and health insurance, but really are living paycheck to paycheck and still make decisions based on seeing the doctor on the basis of, do I put food on the table? Do I pay my mortgage or my rent? Do I give my kids a Christmas? Or am I spending it to go, see my physician? So all that being said, if you think about where hospitals came from, they were built to serve the community.
Yeah.
The institution developed to serve the community and ultimately were awarded nonprofit tax status. You don't have to pay city, state, local, federal property taxes as a charitable organization. But what they found, and by they, I mean the federal government, is a lot of these organizations weren't delivering enough care back to the community to justify that not-for-profit tax status. And some of these entities are behemoths. So if you look at like Pittsburgh with University of Pittsburgh Medical Center, they
Yeah.
own so much property that the city misses out on a few $1 billion of taxes on an annual basis, which are used to fund things like the police and firefighters, yada yada. So IRS 501R regulations are legitimate. You can go to the irs.gov and look at them. Really what they did was establish rules and parameters regarding these nonprofit hospitals on the care that they are supposed to give back to the community. and set some rules around that. And I'm happy to share those rules if you're interested.
Yeah, I actually am, and I also is that the same thing as when nonprofit hospitals put out, like, their report to the community? Is that the same thing, or is that more of a PR thing?
Now, they are required every 3 years to conduct a community health needs assessment.
Okay.
So we're looking at the community and assessing what those needs are for your indigent people, for uninsured, for lower income thresholds, and defining that. If we look at income as a function of federal poverty limits, most financial assistance policies are somewhere around 250%, 300% of the federal poverty limit, and under have
Oh,
eligibility for these programs.
okay, so that's a lot of people.
It's a ton of people.
Yeah,
And as you add spouse dependents, those numbers go up exponentially. So you think about a family of four across the country that's earning under $100,000 a year, that's a lot of people.
yeah, yeah, and is that the only I mean, is it based on income and number of people in the household, and bam, if you hit that number, then you qualify for what exactly?
Yeah, so let me take a step back. That community and health needs assessment, then
Yeah,
after they fulfill that requirement, they then have to put forth a publicly available, accessible financial assistance policy.
really?
And I wish that it was very easy to find those. Most hospitals have gotten pretty good about providing them. Some, it's like finding a needle in a stack of needles, but it needs to be readily available not only to the community, but also every person that comes through their doors. And what it establishes is a limited charges for eligible patients, what's called amounts generally billed, which is an aggregator of everything they receive for procedures and services. And it's not some inflated price. It's like a pretty legitimate actual price. And lo and behold, I think in most instances, it's not too far off from what Medicare allows. In some instances, maybe a little less, roundabout there. And the purpose of this is so that they have a baseline of how to evaluate every person that comes through the hospital to see if they're eligible. Problem is, from an administrative perspective, they don't do a really good job of that. And I'll tell you a little story. I live in central Pennsylvania where we have University of Penn, we have UPMC, we have WellSpan, we have Hershey Medical Center, and then we have Geisinger Hospital that is also about to become Kaiser Permanente.
Whoa, I didn't know that.
Well, now you do, and knowing's half
Okay.
the battle. All not for profit. But I decided to go to a charity event and have a couple old fashions. And then the following day, I had a jalapeno burrito at lunch. And then lo and behold, the next morning I woke up and, fast forward, it was heartburn, but I thought I was having a heart attack.
Sure, symptoms are very similar. Good
Yes,
job for going to the hospital.
it sucked. My wife's like, "You're having a panic attack or something." I go, "No, I think I'm dying." So I march my little tuchus over to the emergency room, and ultimately the first thing they ask for is your insurance card. At no point in time is there ever a process to establish whether or not I have a financial need. Mind you, there's forms that I sign off on that I probably signed my life away and the ability to bill me whatever the hell they wanted to bill me.
Mm,
So with all those things being said, a lot of people don't know, like my aunt that got very, very sick, that this help exists, nor do they understand the process of submitting an application for financial assistance, nor do people in our community understand that this is available to the general pop and or plan participants to leverage.
yeah. So, is this just for uninsured patients, or say I'm a school teacher, fully insured by my school district, have 2 kids, do I qualify?
Yeah. So you asked a question earlier, and I'm going to answer both of those questions.
Perfect.
So under 250, 300% of the federal poverty limit, depending on the financial assistance policy, each one is different. Some may cover certain providers, but for the majority, they cover a lot of your standard things that you would go to a hospital for. With that, There are thresholds for no cost care, so everything will be taken care of.
Wow.
There are also discounts applied, typically in a sliding scale. And then in some major cities, if there is a big need, it may be 400, 500% of the federal poverty limit that's covered and under. It just really depends. And it changes. These hospitals are required to do that every 3 years. With that, to your question specifically about the fully insured teacher who has a few kids, it matter. This regulation applies whether you're insured or uninsured. And the way that it applies is directly attributed to the definitions within the financial assistance policy.
Mm,
IRS is very clear that it applies regardless of insured status. However, we've noticed a trend with not for profit hospitals across the country that have amended their financial assistance policy to say, we will only reduce, discount, or eliminate out of pocket expenses for the individual if they're insured.
interesting. That
So,
makes
so,
no sense.
but they've caught up to the fact that people were leveraging this in
Right.
order to help out the plan sponsor as well.
Mm.
So, we can get into the ethics of, what's right and wrong here.
I mean, that could be fun,
It
but
could,
we won't.
it could be. It's, it's very frustrating because one thing that I think that this discovery and evaluation over the past 4 or 5 years that I've been involved speaking about 501R is that you see this calculation called amounts generally billed, and you see how it compares to what Medicare allows,
Yeah.
and see what compares to like your typical charges on a commercial plan, and then what's paid even after a discount's applied. It's like, dear Lord, we are paying so much in this country. And then let's make matters worse, that same Alice demographic, like the majority of the population don't have a whole lot of money in their checking account
Yeah.
or living paycheck to paycheck. How many people are in collections right now with these same institutions that could have been or should be or are eligible for financial assistance?
Oh, millions of people at least?
I, a lot more than should be. And frankly, I'm a bleeding heart. So even if it's five, that's too many, but we know it's in the tens of thousands of people. We all know that GoFundMe has become the de facto place to raise money to pay for medical expenses. At least 50%
Yeah.
of all accounts have been
Yeah.
to pay for medical expenses. That's a problem.
Yeah. Wow. Okay. And so I appreciate that as a human, you care a lot about this, but I realize, like, for your day job, you work with large employers and hopefully people that are well insured. Although I think a lot of us at times in our lives fall into, a position where making that copay or that co-insurance or deductible is still hard. That said, what in your day-to-day, work, what advice do you have for employers? What role did they play in this?
Yeah, I think that we all play a role, specifically plan sponsors as good fiduciaries to be
Mm,
educators as well for their population and provide their population avenues to save on out of pocket expenses, to ask questions when they go to the hospital, like, what's your financial assistance policy?
yeah.
There are some great programs that exist out there to make this really, really, really easy for people. I know one vendor that does an integration and understands not only on the front end when a claim happens at one of these facilities, but can also pull down the members' financial information and help them complete an application in real time with a single click and
Yeah.
apply for that financial assistance. Where I think it benefits employers not only in goodwill to their population and helping educate them on these these different, federal requirements of these facilities, but also it It's good for the health plan as well when it comes to negotiating large catastrophic claims, using this as a benchmark, uh,
Brilliant.
along with Medicare to say, "Oh, wow, you're charging us 3,000% of what Medicare is, and it's 3,000 or whatever percent of AGB." Like, how can you justify this? So there are a lot of good payment integrity programs out there that use this as part of their evaluation process. For us, I think that not only can you help your employers understand exactly, that this exists, a lot of folks have an aha moment because usually the hospitals are painted as the good guys, and they are. We have providers that care about patients. We have
Thank you.
doctors that they care about patients. That being said, I can't say that the administration is always running it to the best of their ability or abiding by some of the things that we would like to see, as opposed to just sending people to collections, as opposed to really validating if this person was eligible for financial assistance all along.
Yeah.
So I would make sure that you understand as a plan sponsor in your community who are the non for profit hospitals? What are their financial assistance policies? Lean on your advisor to discuss, is there a strategy here for us, not only to protect our members, but to protect our plan? And then search for the vendors that do a really good job of prepayment integrity.
Mm, sense. You use the term AGB. Can you define that?
Yes. So amounts generally billed. Amounts
Okay.
generally billed is limit charges that have to be applied to all the procedures and services that are covered on the financial assistance policy. What the IRS found out is that a lot of the care that was being written off by these entities and why regulations need to be put around it, it was gross charges, it was commercial charges. So
Yeah.
writing off a lot of care, but at an inflated price, that's not really being a good steward of your community, is it not?
Okay. So let's talk about how patients can actually access these programs. I'm a patient, I get a big hospital bill. How do I figure out if I'm eligible?
Yeah. So if you call them and ask them for the financial assistance policy, they're required to provide that to you.
Ah,
So that's one good place to start. I There are certain websites for the non-for-profits where you can easily find the financial assistance policy. Others, it's like going into an Indiana Jones movie and trying to find an amulet that's hidden behind six trapdoors.
yeah.
It shouldn't be that hard. But what you'll do is you'll download and or pull down the application and you'll fill it out. And it's going to ask you basic information regarding number of folks in your household, what you claim on your tax returns last year, may request two pay stubs to be able to submit along with the application. And then you send it off to the ethos. What I will say is if you receive a bill, any bill, it should just be a best practice to go in and see if you're eligible. Uh,
Sure.
Once you submit it, then you're gonna get a formal approval or a denial. What I will say, in many instances, if you get approved, they will then provide you with that discount and or no cost care for future services for a period of time. Beyond that, the likelihood
Wow.
of not being of getting out of the eligibility requirements is very slim. So, in some instances, if you're gonna have, multiple episodes of care or claims, they'll just keep you as approved for a period of time.
Okay. And is that generally, and I know every program is probably different, but is that generally on services provided by the hospital or does that cover any of the hospital based providers?
Well, that's a great question, and I'm gonna give you the consulting answer. It depends. Each financial assistance policy should clearly state what providers, what facilities, what services are covered. And some providers may be covered, some providers may not be covered under that financial assistance policy. So if you've gone in for emergent care, emergency room services are typically covered, but like say you're getting cancer treatments, things like that, it may depend who's eligible under that plan or not.
Okay. Interesting. And then if a patient feels like they're getting the runaround, Do they have any options to advocate for themselves aside from taking the hospital to court, which is probably not very fun?
Yeah, social media is a pretty powerful tool. And I think if it's done anything good in this realm, it's created a lot of organizations out there that will advocate on your behalf. I spent a lot of time, and for those that are watching, I have two posters on my wall here for Power to the Patients, Patient Rights Advocate. They've been advocating for hospital transparency for years and played a big part in the hospital transparency law that passed. Unfortunately, only 35% of hospitals here years later are abiding by the rules. We have some penalties that may be increasing to help, whip them into shape. But there are a lot of organizations like Power to the Patients and Patient Rights Advocate that you can reach out to, and they'll steer you to the right resource to help you, get representation. And it's very unfortunate the amount of people that do get the runaround when it should be a simple, straightforward process. So, I think Google's probably your best friend, and you'll get a bunch of different organizations that pop up that would be willing to take on the fight and or get you to the right people that are probably fighting the same battle.
Nice. And I'm so glad you explained that, Justin, because I thought you were just a 90s rocker. For those of you that can't see it underneath Power to the Patients, it's Foo Fighters and Stone Temple Pilots. I missed the whole point of that. So thank you for that.
Yeah, yeah. So Cynthia Fisher is the president of that organization. I got a call from her in 2017 because we're doing direct contracting in central Pennsylvania and cutting out middlemen, doing direct contracting for outpatient surgeries and procedures and saving a buttload of money.
Nice.
It's like, hey, I heard you're proving the concept that we're trying to prove to the Trump administration that if you eliminate middlemen and you can shop for pricing, it keeps healthcare costs low and it doesn't sacrifice quality. So she came down and met with us, and she's just a bad arse in her own entrepreneur, sold a company for hundreds of millions of dollars. Her hubby owns Sam Adams Boston Beer Company. Uh,
Wow.
yeah, yeah. So she comes down and meets with some of our clients. Next thing we know, one of our clients is going down for the hospital transparency law signing with the Trump administration. And yeah, lo and behold, the fight continues on. But I've gotten a front row seat to meet a lot of cool artists who have gotten behind this cause, like Dave
Really?
Fighters,
Uh huh.
Jelly Roll, Chuck D from Public Enemy, Fat Joe, who's not fat anymore, and a number of others who are supporting, because most of those people come from communities too where they're, like me, I was a chip kid, Medicaid, and it shouldn't be like that in our country.
Yeah. Yeah. Oh, that's really cool. Thank you for the time that you give to that.
Of course.
Okay. So, last question, Justin, from an employer perspective, and you've already mentioned this a little bit, but what can HR or the benefits team do to help educate people? Is there something they need to do during open enrollment or post claim support? How can they make this part of their process?
Couple different ways. One, I think education is paramount. You can include information regarding your local financial assistance policies at the local hospitals and open enrollment, or at least direct
Nice.
people. If you or some of your love is struggling to afford their care, here's a resource available to you. If they're looking at a plan option to be able to incorporate this into like a self-funded strategy, a MERP strategy, or what have you, really, I think it pays dividends to get in touch with a strong legal counsel to be able to amend the plan to meet the needs of your specific population. I know Julie Selesnik with Health Plan Legal Counsel has been just a pioneer in a lot of these strategies, and also approaches it from a standpoint of defensibility, but
Hmm.
also understanding that we're not here to abuse these programs. We're here from an accountability perspective to make sure that everybody's
Right.
benefiting from these programs that are in place. And then there's a handful of vendors out there that I think are doing really, really cool, innovative stuff to make it as streamlined as possible. Because as you and I know, the interoperability of a plan and the components of a plan is paramount to the success of said plan.
Absolutely.
It has to work.
Right. Right. And I'm so glad you pointed out too that none of the intent of sharing this is to abuse these programs because we need them to stay in place so patients can get care, and we need nonprofits to be able to remain open so that they can. But just making sure that there's transparency and everybody knows about it, because I don't think any of us want to see our neighbors struggling because of a medical bill.
And I'd be remiss to say that there aren't misaligned there isn't misalignment within our culture, within our society. I got into let's call it a heated debate with the head of a consortium not too long ago, who stated that transparency is bad for healthcare and drives up prices. And I started to get that twitch, almost had a stroke. Really, Amanda, it's about doing the ethical thing and creating an environment where capitalism can exist, where, there's fair prices that are paid, and people that are hurting or suffering have access to the things that not only they deserve, but they have a right to under regulation. So I'll continue to champion that till the day is long.
Absolutely. And you and I pay taxes so that those entities can continue to exist. And if you're in a community like Brett and I lived for 20 plus years in a community where we literally paid county hospital taxes, which I did gladly, because if anybody ever has a terrible burn, I want you to be able to go to Parkland, and I want you to maybe even be able to do it for free. But they
Yep.
need to be there to serve the people that need them.
I was about to say a bad joke. You pay taxes? I'm just kidding.
You know, I do. I love streets and schools and all those things. And would I like to pay less? Yes, but I do pay taxes.
My wife's a public school teacher, so
Oh, well then, yeah, absolutely. Well, thank you for taking away the myth of insurance brokers being just all capitalistic. I think that you really illustrate how to lead with heart and with caring for the people that we serve. And I suspect that's how you and Brett became friends.
I love the man to death. I think he's one of the best human beings, and he, like myself, are a compassionate capitalist. You can do very well by doing good, and I think we need to understand that more as a society here as we move forward.
Yeah. Awesome. Well, thank you for your time, Justin.
Of course, Amanda, thank you.
Big thanks to Justin Leader for sharing his expertise and shedding light on a little known but incredibly powerful patient protection. If you're dealing with a hospital bill or you know someone who is, this conversation is your reminder. Ask about financial assistance. If it's a nonprofit hospital, they're legally required to have a policy, and you might qualify even if you're insured. And if you're an employer, consider adding this to your benefits education. Helping your team understand their rights and resources isn't just smart, it's generous.